She's talking about lowering drug costs, expanding Medicare, which I find fascinating. We're in the enrollment period right now, and helping the entrepreneurial spirit by giving some money for those who want to try to live their American dream. The question is that trifecta possible in today's climate? Jay Costa.
Oh, there's no question that it's possible, and it's a clear plan to be able to help folks around this country. And I'm like you, I'm supportive. I'm in the same age range as you, and I think these are important things that we pay attention to and are important to folks. So and I do think that it's definitely possible. And working with the Congress and a U.S. Senate, being able to manage, if she doesn't have a majority in both parties, of course, being able to work to compromise to advance it. That's what's important here. And I think she's got the temperament to be able to do that. And I think that's what has to happen. But I think these are the hot button issues that people want us to talk about, as well as the economy and some other things.
Listen, I don't think I've ever met a politician who is out more amongst their constituents than you. I follow your social media platforms, and there's not a day that you're not with the people. So I got to believe that they talk to you about the soaring cost of drugs and prescription medicine that they need to survive day to day. And they're always hoping for a little bit more when it comes to their health care coverage, because what happens, so many people that really need routine exams and physical checkups and visits to the hospital or the doctor's office are bypassing a lot of this stuff because they can't afford the out-of-pocket expense, meaning copays, because they're on a fixed income. So what she's talking about, there's a reason, because you and many others in public office, I'm sure, hear the same thing over and over every day you're out and about.
Oh, there's no question that we hear day in and day out, whether it's relating to prescription cost or cost of groceries and the like. We hear about it quite frequently, to be honest. And I think what she's talking about, what's been done both at the federal level and at the state level, working to be able to make it easier for folks to purchase those things. When we look at our PACE and PACEnet program in Pennsylvania, the changes we made to expand that over the course of the past several years, whether it be property tax, being able to afford your property taxes. We've taken steps to address that to help our senior population there as well. These are all things that we hear. And she's hitting on the hot button issues that people need to, who think about day in and day out. Those are the issues that are concerning to the people of Pennsylvania and around the country. And that's why she's pivoting to talk about those important issues. And they go into the whole economy type, inflation type conversation that's taking place. But we have more work to do. We have to have a plan to be able to do that, more than a concept, but a plan that's going to be able to address that. And I think that's what she's going to be doing when she gets into office. And tonight I had a chance to see part of her town hall she had, or not town hall, but her rally she had. She talked about the specifics of cost of Medicaid and cost of medicine and the cost of other prescriptions and the cost of health care. Those are important aspects of what needs to be addressed. And she's ready to address them and find a compromise and bring people in who don't agree with her idea, bring them to the table to say, help me find a solution that we all can agree to.